Have you ever looked at your baby and wondered, should I go to the emergency room or am I overreacting? As a healthcare provider, I can tell you that parents ask this question every single day. Sometimes it's something that can safely wait until the pediatrician opens, but sometimes waiting could put your baby's life at risk. Today, I'm going to walk you through 10 warning signs that mean your baby should be evaluated immediately in the emergency department. Let's get started. Hi, I'm Dr. Tanya Bro Shropshire, family nurse practitioner. Here, we provide evidence-based information to help parents make informed decisions during pregnancy, after delivery, and throughout their baby's first years of life. Remember, this video is for education and does not replace medical care. If your baby appears seriously ill or you're concerned something is very wrong, trust your instincts and seek emergency care. The first warning sign is fever. Not all fevers are emergencies, but age matters. If your baby is younger than 3 months old and has a temperature of 100.4 degrees Fahrenheit, or 38 degrees Celsius or higher, they need immediate medical evaluation, even if they look well. Young babies can develop serious infections without showing many other symptoms. For babies older than 3 months, fever alone isn't always an emergency. However, if the fever is accompanied by difficulty waking, poor feeding, breathing problems, or unusual sleepiness, seek care immediately. The second sign is difficulty breathing. Watch for fast breathing, ribs pulling inward, grunting nostrils, flaring, wheezing, difficulty catching their breath. If your baby cannot cry normally because they're struggling to breathe, that's an emergency. Healthy babies may breathe quickly at times, but persistent breathing difficulty should never be ignored. If your baby's lips, tongue, or face become blue, gray, or pale, call 911. Tell 911 immediately. This may mean your baby isn't getting enough oxygen. Do not wait to see if it improves. Babies become dehydrated much faster than adults. Warning signs include fewer than 6 wet diapers in 24 hours after the newborn period, dry mouth, no tears when crying, sunken eyes, sunken soft spot on top of the head, extreme sleepiness. If your baby refuses fluids or continues vomiting, they need urgent evaluation. A baby who suddenly refuses to eat should be evaluated, especially concerning if your baby cannot stay awake to feed, stops sucking after a few seconds, vomits everything they eat, shows signs of dehydration. Babies rely on frequent feeding to maintain blood sugar and hydration. A seizure can be frightening. Your baby may shake rhythmically, become stiff, stare without responding, have repeated jerking movements. If your baby have a seizure, call 911. Tell 911 immediately. Afterward, lay your baby on their side and never place anything in their mouth. Babies sleep a lot, but there's a difference between sleeping and being difficult to wake. Seek emergency care if your baby won't wake to eat, is difficult to arouse, doesn't respond normally, appears limp. Parents often notice something isn't right before anyone else does. Trust that instinct. One spit up isn't concerning. Repeated vomiting is different. Go to the emergency room if your baby cannot keep anything down, vomits green fluid, has blood in the vomit, appears dehydrated, has vomiting with a swollen belly. If your baby suddenly becomes difficult to wake, weak, limp, not making eye contact, not responding to your voice, this requires immediate medical evaluation. Parents know their babies better than anyone. Even if you cannot explain why, if you feel something is seriously wrong, seek medical care. Many parents later say, I just knew something wasn't right. Never ignore that feeling. It is always better to have your baby evaluated and be reassured than to delay care for a serious illness. Let's quickly review the warning signs. Fever in babies younger than 3 months, trouble breathing, blue lips or face, dehydration, poor feeding, seizures, extreme sleepiness, persistent vomiting, decreased responsiveness, your instincts tell you something is seriously wrong. Knowing these warning signs can help you act quickly when every minute counts. If you found this video helpful, please like, subscribe, and share it with another parent or caregiver. You never know when this information could help save a child's life. Thank you for watching, and I'll see you in the next one. Stay informed, stay prepared, and take care.